Surgery is one of the most commonly used treatments for cancer. If identified early enough, surgery can be a curative way of treating cancer, often without the need for any further treatment. Sometimes, however, surgery needs to be used together with other treatments, such as radiotherapy or chemotherapy, to give the best chance of long-term cure. At CUH, cancer patients are often seen by surgeons as the first specialist regarding their cancer treatment. Prior to that, however, the patient will have been discussed in a multidisciplinary meeting to consider the best way of treating their particular cancer type. Very often a biopsy will be recommended to identify if the lump is in fact cancerous and needs further treatment with surgery. If surgery has been recommended, the next step is to assess the patient's fitness for an operation. Depending on the location of the cancer and the body part affected, surgery can be relatively minor or extremely major. This will be discussed with the patient in detail to ensure they understand the procedure and that they are fit enough to proceed with surgery. These assessments are often undertaken in conjunction with the anaesthetic teams in the pre-assessment clinic before confirming that surgery will take place. At the pre-assessment clinic, which usually takes place in the Addenbrooke's Treatment Centre, a detailed assessment of the patient's medical background will be completed, as well as assessment of the heart and lungs and blood tests to ensure fitness. Surgery can either be undertaken using traditional open surgical approaches where a large cut is made to access the organs, or by using keyhole approaches where only small incisions in the skin are made. The keyhole method can be undertaken using standard keyhole surgery instruments or by using robotic surgery platforms. This approach will allow for a more rapid recovery from surgery. The location of the surgery will either be in the Addenbrooke's Treatment Centre or in the main surgery complex, located in the central part of the hospital. On the surgery day, you will most likely attend the Addenbrooke's Treatment Centre early in the morning to check in for your surgery. You will then be seen by the anaesthetist and the surgeon and will change into a theatre gown. When it's time for your operation, you will most likely walk into the theatre by yourself. The anaesthetic and surgical team will welcome you and undertake safety checks. They will then administer the anaesthetic before the operation. After surgery, you will return to the recovery area to ensure it's safe for you to be transported to a ward to recover from your operation. Some surgeries will allow us to discharge you home on the day of surgery or after only 24 hours, whereas bigger, more invasive operations may require a length of inpatient stay. During the inpatient stay, you will often meet physiotherapists and occupational therapists who will ensure you are back on your feet and able to get home. Your convalescence will continue at home and you'll be discharged with appropriate medications in order to allow smooth recovery. Generally, the results of your operation will tell us the detail of the cancer that has been removed. Approximately 6 weeks after the surgery, you will return to the clinic to be seen by the operating surgeon and their team. They will check whether everything has healed nicely and whether all blood tests and other assessments are satisfactory. A decision will then be made about the need for further treatment and the method of follow-up. Throughout your treatment, for the vast majority of cancer types, you will have access to a cancer nurse specialist who will be your first point of contact to ask questions or raise concerns that you might have either before or after the surgery.